Hello, everybody. Thank you for coming to the BVI booth for the talk. I am Dr. Camille Bosc from France, and I will share with you my results with the BVI Premium IOLs. So, for a small introduction, I work in the Ophthalmions group in Nantes, France. We are the largest private practice in France, with 42 ophthalmologists and about maybe 25 surgeons. We do more than 12,000 cataract surgery per year and about 400,000 consultations. We have a strong history with Physio and BVI as a strong partner. The Fine Vision family is the first full range focus lens we use at the clinic. The Podiatric is the first toric lens, and the Isopure is the first premium monofocal lens in terms of volume. Okay. And so I will share with you some interesting results about the Fine Vision family, which for me is the most predictable, tolerant and efficient trifocal lens on the market. And to make it real, I will talk about correlation with pupil size and aberrometric profile of the cornea after implantation of the Fine Vision. So this is a series of 47 patients, which I did between 21 and 24. And the objectives were to evaluate our clinical outcomes and if there is a relationship with the visual acuity far and near with the pupils, photopic pupil size, and also the corneal aberrometric profile. So on the post of the refractive data, we see that the Fine Vision is really precise, it's really reproducible, so the results are not as good as Professor Akaushi, but still we have more than 80% of the patients which are within 0.5 diopter from zero, and the same goes for the cylinder. So even on the toric and non-toric, the refractive target is really precise. I used the ESCRS calculator for all the premium lenses, and especially the DGS Pearl formula. On the uncorrected visual acuity at 1 month, it's really excellent because the 80% of the patients are already 20/20, so still there is a neuroadaptation as for every trifocal. But for being a user of different trifocal, for me the Fine Vision family is the fastest neuroadaptative lens also on the market. And the binocular near vision is also excellent. And a little precision in France, with the standard chart of near vision, we don't test over 0.1 logmar of near visual acuity. So for us, it's like the maximum. So almost everybody is at 0.1 logmar after 1 month. And the best corrected visual acuity is also perfect. And after 3 months, with the neuroadaptation, there is an improvement, and you see that almost every patient is 20/20 uncorrected binocular, and 100% is 20/25. So in terms of functional result on the far visual acuity, it's really excellent. And this is the reason for especially the younger patients and the prelex patients. The Fine Vision is my first intention trifocal lens. And also after 3 months, 100% of the patients were 0.1 logmar on near visual acuity, so the maximum for us in the tests. So really excellent results. For the toric, which it's the quality of the Podiatric, so it's easy to fold, easy to inject, easy to place in the good axis, and very stable. So this is like the Bosc quality, stable and easy to rotate. The correction of the cylinder is really excellent, and there was no difference with the toric patient and the non-toric for the result in terms of visual acuity. So really, it's really excellent complements. And in terms of binocular defocus curve, our results are even better than the past generation of the fine vision. So as you can see, the vision is over 20/20 from 0 to -2.5 and over 0.1 from 0 to -3 diopter. So really, it's really excellent results, and the flattest curve for the premium lens that we are using. So in terms of results, this is predictable, this is good results, and this is the other quality of this lens. It's even we know that for a premium surgery you have to be super precise, super strict with your indication and the screening and the surgery. The fine vision is a forgiving lens, so there is a tolerance in terms of cylinder, and which is super interesting. We do, in complement of the biometry for every patient, a screening as we were doing a LASIK. So we have a topography with the Sirius from CSO, where we have the corneal aberration and also a dynamic pupillometry. So for every patient we test photopic, mesopic and scotopic pupilla, and there is absolutely no correlation in terms of distance and near vision visual acuity with the pupil size for those patients. So for example, for the younger patient with a pupil at over 3.5 or even a 4 millimeter diameter, you can go with no problem with the fine vision. And the relationship with the visual acuity and corneal aberrometric profile is also independent. My personal cutoff is 0.5 HOA on the CSO, but in this series we have some cases post laser refractive surgery, and the results are as good as in native cornea. So really, efficiency and tolerance. So for the high volume surgery, this is the two key points that we need to be safe and to be able to propose with no fear the premium lens surgery. So in conclusion, fine vision IOL family provide excellent refractive and visual outcome at all distance. The results are not 100%, but almost 100% predictable and repeatable. Pupil size is not correlated. The quality of vision is not correlated also with corneal aberrometry with the normal range, and the range of focus is excellent and continuous. Thank you for your attention.